Hello everybody and welcome to the Thursday edition of Video Clips. I have a lot of different things to share with you today, and I'm going to start with a very thoughtful email I received from a physician colleague of mine, and he says, I wanted to give you my point of view as I'm in the center of this mess, and I watch and love your show on YouTube. Thank you. Here's an update as to what I've seen in the patient population and within our company. At the beginning of last week, I personally have had over 650 COVID patients. I've had 4 go to the ER, 1 almost went to ICU, and none have died. I've had people get very militant toward me after explaining this to them. My staff has reported similar outcomes in their own population. For some reason, there's been more mortality seen in the general population than by me. I seem to be missing all the action. Even my parents claim to know casualties, but when I question them, the knowing seems to be 1 or 2 degrees of separation. My neighbor's cousin passed away. My parents didn't actually know them. So I'm part of a franchise with almost 24 clinics, one of which is in an area designated as a hotspot. As of 2 weeks ago, our risk management team reported that we have seen a total of 3 deaths. I almost couldn't and still somewhat can't believe this. What's going on? We've used about 5 different tests, and just like the most recent tests, all have serious problems, including recalls, official reports of contamination, and inaccuracies and defects. I'm confident that the new ones, like the old ones we use, are complete crap. That's a quote. It's quite an amazing thing that azithromycin, hydroxychloroquine, MMS, ozone, vitamin D, ultraviolet phototherapy, sunlight, many other therapies have success that is openly being denied and worse yet touted as dangerous, whereas steroid drugs and remdesivir and ventilation seem to be considered best practices and continued at all costs. There may be reasons to say that we need more information on some of these and more research, but the ones we're encouraged to use are quite ghastly. We providers strongly believe that financial incentives control what will be used and what will not be used for patient care. An expensive and useless drug will actually reach prime markets. Though understandable, many places seek to make up for lost income in the past few months by increasing testing. Now our typical patient comes in with seasonal allergies and is given 2 COVID tests, the swab and the antibody test. The absurdity of the situation makes me dizzy. There's no shortage of people with allergies right now. We also offer COVID testing for people with allergic conjunctivitis and heartburn by the dozens daily. Sometimes I think I could actually get away with recommending Harvoni or a biologic like Humira for COVID prophylaxis. It makes as much sense as what's going on right now. I did residency at Flushing Hospital, which is an epicenter of the virus pandemic. I volunteered there and at 3 other hospitals for a total of 4 days. During that time, I saw no action either. It's true, people get treated for pneumonia and intubated in the ER, but I'm in close contact with my colleagues there, and in mid-March, the entire staff had nothing to do. Remind you, this is in Flushing, where things were supposedly bad. Some people were caught drinking on the job, and there was a sea of volunteers in the hallways, all excited at lunch to get their free lunch and have a social hour with the others. It was an eyesore. So then the furloughs came and 70% of the employees were temporarily canned. Then, of course, things got really busy, but this is because of the terrible management of employee resources, not because there was an actual virus issue. I tell you, as much as I don't want to be a virus denier, I'm not sure how what I see on the television is at all possible. Again, I must have just missed all the action. Now the concept of telemedicine has taken over what I once knew to be my job. The idea has invaded my practice, which is financially suffering and in the red for the past few months. While some things like refills and spring allergies work fine with telemedicine, other things don't. Yet this type of visit is now the norm, and I, as an internist, am just 1 step closer to becoming a vending machine for antibiotics. So it's always interesting to hear from a real doctor who is in the middle of this mess and what he or she has to say about it. So now we'll move on, because the topic for today is inaccurate data. So let's talk about some more inaccurate data. The Strategic Advisory Group of Experts, which is known as SAGE, was established by the Director General of the World Health Organization in 1999, and the purpose is to provide guidance in the areas of issues like vaccines and technology. On the WHO's website, it states that SAGE is concerned not just with childhood vaccines and immunization, but all vaccine-preventable diseases. Interestingly, a meeting was held on May 7th, but the minutes weren't posted on the website. The April meeting is posted, and the next meeting, according to the website, is scheduled for October 6th to 8th in Geneva. The government of the UK obtained the minutes of this May meeting of SAGE directors, which was conducted via Zoom. And I think the excerpts are just really worth talking about. SAGE, and this is a quote, Sage noted the important contribution made by Neil Ferguson over the course of the response and agreed the importance of continuing to draw upon the world of the Imperial College team. Neil Ferguson has a track record of developing bad models that have cost governments billions of dollars. The model that he and his group at Imperial College of London was 96% off. This is the one that idiot Fauci and his cohort of criminals and criminal affiliates all across the country, all across the world, are using to lock people down, destroy people's businesses, keep kids out of school, based on a model that was 96% off. And this committee says that they want to thank him for his wonderful work and emphasize how important it is to keep adhering to that bad model that's 96% off. How can they do this? I mean, it's amazing. By the way, they noted the need for pastoral support to the committee members. Ian Boyd is an independent participant whose role includes providing this type of support. So the committee members who are counting on a model that has been proven to be inaccurate, meeting by Zoom, need pastoral support for their work, but God forbid anybody go to a church for pastoral support. Dangerous with the virus. I mean, I can't believe it. So then they go on to say, this is the minutes, granular data are not yet currently available to fully understand transmission pathways in healthcare settings. Preliminary data suggests the prevalence of COVID-19 in healthcare settings is 2 to 4%. Yet people are dying alone and separated from their families and friends at the end of life, based on this inaccurate model. Quote, Sage agrees that as steps are taken to ease the lockdown, tracking of emerging patterns of public support, non-adherence, and potential social disorder may be useful. What the hell does that mean? Okay. Many attendees, by the way, had their names blacked out, scientific experts and observers and government officials and the SAGE secretariat, whoever that is. So it clearly shows that this is a group that advises the World Health Organization. Now, the World Health Organization is being advised to follow an inaccurate model in making its decisions. And those decisions affect people like you and I every day. It just almost blows your mind. I mean, I looked at the resumes of the people on this board, and they all have very prestigious resumes. So for those of you out here who think that the thing to be paying attention to is pedigree, oh my gosh, do these people have pedigree? They just apparently can't read scientific information, because 96% off, I mean, if somebody was 96% off about anything here, we'd fire them, all right? If I was 96% off, I'd fire myself. All right, so while we're on the subject of inaccurate information, I think the Centers for Disease Control and Mr. Fauci, I refuse to call him a doctor, I think they're having a competition to see who can screw up and promote the worst information that needs to be retracted possible. So last week I talked about the mess that Fauci's made, but he had lots of help. I mean, you know, he's got the criminal co-conspirators at the World Health Organization and the SAGE group, and so here are some examples of CDC and their misbehavior. The CDC's inaccurate information about the virus living on surfaces for days scared people about touching cans and jars and induced panic about even going out of the house. I've had people send me pictures of people washing, leaving the groceries on the porch for 2 weeks or for 2 days rather, and then washing all the jars and cans because they're afraid virus is going to come into their house. Well, never mind, the CDC later said that's not true. And of course, we all remember the famous directive, which was repeated by Deborah Birx, another really qualified individual. She actually instructed doctors on national TV at the White House press conference to falsify death certificates and classify anybody who died with COVID-19 as a COVID death, even if the cause of death was clearly something else. This advice, of course, has resulted in inflated death rates, and right now there have been lawsuits, and many states are starting to adjust their death rates downward by as much as 20% because they're being pressured to be honest. Apparently, you have to be pressured to be honest when you're the ruler of a state. The CDC then recommended that minorities without symptoms should be prioritized for testing, but then withdrew that recommendation and instead replaced it with an advisory that all Americans should be tested, can be tested regardless of race or ethnicity. And then the CDC issued guidance for churches that included instructions to wear masks, stay 6 feet apart, avoid sharing cups and dishes, and to reduce singing to spread the virus, to reduce the spread of the virus. The CDC actually referred to choir practice in Washington state as a super spreader event. This is terrific. On top of everything else, let's scare people about singing. And let's give the Emperor Inslee in Washington state, who's shown that he has absolutely no regard for human life, another reason to lock people down and prohibit them from doing dangerous things like singing. The inspiration behind the guidelines, the godless criminal Fauci, who told a Catholic magazine that communion and singing during religious services should be avoided. He described the potential for the virus to spread while singing as, in some respects, scary. You know how scary singing is, and you should cut it out, right? Well, the CDC changed its mind and has deleted guidelines discouraging church choirs and shared communion cups, but the damage has already been done. I probably have had close to 1,000 emails from people who are upset because their children are not going to have choir at school and the church that they go to is not going to allow choir. So here's my advice, and this is where, again, we're going to announce our initiative soon, but I'll give you some previews. I think that this is where we need to really take a stand. If your church does not allow singing, then I think what you do is you take the people in the church who want to sing and you find a place to have church. We have a great big room here. As long as people don't sing during yoga classes, we would allow somebody to use our space for church and you can sing your heart out. I think it's wonderful. I might come over and join you and listen, all right? So, and parents of kids who would normally have choir at school, have choir at home. Get parents together, form your own choir. There are all kinds of music teachers out there who would be willing to help kids sing in a choir. We don't have to take this, and there are ways around these kinds of restrictions, and we need to be doing more of this. And I think what will happen is if huge numbers of congregants leave the church, if people say, you don't want to have choir at school, no problem, we'll have our own choir over here. You take the wind right out of their sails. That's the kind of resistance that I'd like to see going on around the country and around the world. Well, a few days ago, this didn't get any attention. The CDC posted updated estimates of the overall death rate for COVID-19. And they're stating basically that the likely death rate is 0.26%. This is the same death rate that was predicted by the Stanford University group, who once they issued it, I mean, the Stanford group used to be the toast of the town until they started talking about real COVID data, and then they became pariahs. Anybody who talks about real data in this whole thing is automatically discredited and called names and that sort of thing. Now, the World Health Organization, advised probably by this age group, predicted the death rate as 3.4% mortality rate. So they were off, one could say. But this was used to justify locking people down, taking away our rights, and that sort of thing. Now, it has been, many groups of people have been tested and shown that 50% or more are asymptomatic. Well, the bigger the asymptomatic group, the larger the projected population of infected people, which drives the death rate down even more, and it might be even lower. I mean, John Ioannidis at Stanford said it was 0.2%, lower than the 0.26% that the CDC is currently claiming. So anyway, just a few of the populations that have been tested to show you what the asymptomatic rate has been. The Diamond Princess, 72% asymptomatic. USS Theodore Roosevelt, 60% asymptomatic. Tennessee Prison, 98% asymptomatic. Pregnant Women in Labor study, 79% asymptomatic. Meatpacking plant in Missouri, 100% asymptomatic. Boston homeless population, 87.8% asymptomatic. And of course, nobody covered this in the mainstream media. The CDC has ratcheted its projected death rate down to about what it is for seasonal flu. And yet the emperors and empresses, the rulers who are keeping control of our lives, if they know about this and they're not adjusting what they're doing, they're criminals. And if they don't know about this, they're criminals because their job is to know about this. If I was the director of the Department of Health, I'd be looking at the CDC data every day. And as soon as they issued the directive to falsify the death certificates, I would have resigned my position or as a condition of staying, I would have demanded that that activity not happen in this state. Instead, this little nitwit went right along with it. And by the way, just a word, I know that sometimes I get carried away and I call these people criminals and nitwits. They are criminals and nitwits. I don't know what other term you use to describe. I can think of some other terms I'd like to use, but I'm not going to do it because I think that's impolite. I will stick with cleaner names, name calling. But I have no respect for these people, and I'm not going to fake having respect. I don't respect their position. I don't respect their authority. I will be a law-abiding person, but I certainly am not going to have anything good to say for people who are perpetrating what we're talking about on this channel every week and lying to the public every single day. All right, so while we're